Oh, hello nurses and hello world. This is nurseniezl and welcome back to my channel. This video is solely for demonstration purposes as interpreted by the actor based on her understanding of the specific skill with reference to the Royal Marsden Manual of Clinical Nursing Procedure 10th edition. All information presented are public domain materials accessible through the relevant governing organizations' websites. Subtle similitude may be noticeable, however, this is not intended to be definitive guide to the NMC Part 2 Test of Competence or the OSCE examination. This can be a helpful material for overseas or internationally trained nurses to learn and adapt to the UK clinical settings and transition effectively into practice. Blood glucose monitoring is one of the new OSCE skill stations that has been added recently. And yes, of course, today I'm going to show you how to do a blood glucose monitoring. That being said, you have to do this station within 8 minutes. And since it's just 8 minutes, then the examiner or the assessor will inform you that the ID check and consent has been done. So all you have to do is to perform the procedure. If the candidate does not demonstrate knowledge of normal range of the blood glucose level or does not act appropriately, or if you didn't acknowledge the abnormal reading of the blood glucose level, then it's gonna be a fail. And we don't want that. So today, that's why I'm going to show you how to pass this station. Oh, here's the strange thing. Usually, they're gonna provide you a mannequin. You have to speak or talk to the mannequin, obviously, and you have to get the blood glucose of the patient. Here's the new technology. As I have heard, the mannequin will bleed once you pierce the finger. So don't you worry, you'll be able to get the blood sample. Or sometimes, I guess, what I've heard, they're just gonna give you a result. But before we head into it, please give this video a like and subscribe to my channel. Also, if you want to get notified just in case I post more videos, then hit the notification bell. Also, comment down below what videos you want me to do next. Okay, let's begin. In this scenario, the examiner or the assessor will tell you that the ID check and consent has been done. So all you have to do is to do the procedure. This is a community prescription. Please read the prescription carefully. According to the scenario, you are visiting a new patient at home who has been recently diagnosed with diabetes mellitus and now on insulin to control her blood glucose level. You are the nurse advised by the GP to check Nicole's post-meal blood glucose level and report back to the GP for update. All the equipment you need is provided. Please administer the medication using the prescription below. It is today and the time is 8 in the morning. So the first thing I'm gonna do is I'm gonna wash my hands using the 6 steps of hand washing. First, I'm gonna wet my hands. Get some soap. With 5 backward and forward stroke from palm to palm, right palm over the left torso and vice versa, fingers interlaced, fingers interlocked, rotational rubbing of the thumb and vice versa, rotational rubbing of the finger clasp, and rotational rubbing of the wrist. Rinse it thoroughly with water. And then pat it dry with clean towels. Dispose it in the domestic bin. Pat it dry. And again, there you go. That's how you wash your hands using the 6 steps of hand washing according to the World Health Organization. And then I'm going to get the tray. Miss Examiner, are we going to use a disposable tray? Yes. Okay. So, as confirmed by the examiner, I'm going to use a disposable tray. If you're not going to use a disposable tray, then wear your apron and then your gloves, then clean the tray, okay? The non-disposable tray from the inner to outer with a Cleanel wipes, okay? Okay, let me just gel my hands. Okay, I'm gonna arrange now the articles that I need for this procedure. Let it try for 30 seconds. So, arranging. I have got here the machine. Checking if it's working. Yes, it is. So, Miss Examiner, is this blood glucose machine calibrated and ready to use?
It's ready to use.
Okay. Next, I'm going to get the strips. Okay, so this strip, Miss Examiner, is this strip been stored accurately and not been exposed to air?
It has been kept appropriately.
Okay, so let me just check the expiry date. I can see it's the 10th of 11th, 2024. So I'm gonna put it here. So I get here the lancet as well. Okay. Then I also got here the gauze, okay? Clean and intact. I got the expiration date of 10th of the 11th, 2026. Get here the pair of gloves as well. Okay. I'm gonna apply now my apron. And then gel my hands. Then let it dry for 30 seconds. I'm ready to go now to my patient. Alright, so before approaching the patient, I'm just gonna gel my hands. Try backward and forward throw, palm to palm, right palm of the left torso and vice versa. Fingers interlaced, back of the fingers interlock, rotation rubbing of the thumb, rotation rubbing finger clasp, and rotation rubbing of the wrist. Let it dry for 30 seconds. So, hi, I'm nurseniezl and I am here to check your blood glucose level. This is your post-meal blood glucose level, if that's alright with you.
Yeah?
Okay, so as said by the assessor at the beginning, that ID check and consent has been done. So I'm just gonna do the procedure as a whole, okay? But before doing that, what can I call you, by the way?
Just call me Nicole.
Nicole, are you in any pain at all?
I'm okay. I'm not in pain at the moment.
Are you comfortable?
I am comfortable.
Okay, so you said you have no pain from 0 to 10, 0 being no pain and 10 being the worst. Can you confirm it's 0?
Yes, it's 0.
Okay, cool. So Nicole, before I start, can I just ask what time did you had your breakfast?
I had my breakfast around 5:30 a.m.
5:30 a.m. So don't worry, it's just 2 hours, 2.5 hours ago. So we'll check your post-meal blood sugar level, okay?
Alright.
Okay. Since I'm going to check your blood glucose level, we normally take it from your fingers, okay? It should be on these 3 fingers. We don't normally do it on your index finger and then your thumb. So on these 3, which one do you want me to do the blood glucose checking?
You can check it on my middle finger.
Okay, cool. So which arm, by the way?
On my right.
Okay.
Right arm.
So, did you say your right hand, okay? Again, middle finger. Because the side of the piercing should be rotated, okay?
Alright.
Just gel my hands first. I'm just gonna gel my hands. Okay, so let it dry for 30 seconds. Wear my gloves. Check if the patient's hands is visibly clean. Turn on the glucometer. Then insert the testing strip into the glucometer. Take a single-use lancet and takes blood sample. Sharp scratch. Make sure that the window on the test strip is entirely covered with blood. Apply a piece of gauze to stop the bleeding. Okay, are you happy to take it?
Yes.
There you go. Okay, so I can see the result is 6.0. Alright, so the sharps that we've used, put it in the sharps bin. The non-sharp would go to the clinical waste bin. Remove the gloves. Remove the apron. And I'm gonna gel my hands. Let it dry for 30 seconds. The result of the post-meal blood glucose level is 6. I need to document it. Again, the time is 8. And blood glucose pre-meal, post-meal. So it says here, post-meal. Okay, and then signature. Okay, so that's it. Okay, so for this machine, I just need to verbalize. I have to clean it and then put it to where it should be kept. And then, so I need to verbalize the result of the blood sugar level of the patient and what action do I have to do about it. So, Nicole, the result of your post-meal blood sugar level is 6.0 millimoles per liter. I'm not worried about it because it has been like more than 2 hours, 2 hours and a half since you had your meal anyway, okay? The recommended target blood glucose level ranges varies from each and every site. I would recommend for you to just use in accordance to the NICE or the NICE guidelines. So like I said, for this patient, I am not worried because it's still under 8.5 millimoles per liter, which is 2 hours after meal.
Alright.
Okay, cool. Do you have any question for me?
No questions at the moment.
Are you comfortable?
I am comfortable.
Okay, so I am gonna go now. If you need anything or if you have any queries at all, please call the GP or your district nurse. Also, if you have any emergency, please call 999, okay?
Alright, thank you very much.
Okay, thank you so much for today. And after the procedure, I'm gonna gel my hands and let it dry for 30 seconds. Also, I'm gonna verbalize that I'm gonna wash my hands using the 6 steps of hand washing. And just like that, we are now done with our blood glucose monitoring station. So, if you like this video, give this video a like and subscribe to my channel. Also, if you want to get notified just in case I post new videos, then hit the notification bell. Also, comment down below what you like about this video and what you don't like about this video. Also, comment down below what other videos you want me to do next. This has been nurseniezl. See you on the next one. Bye!